Well, hi everybody. I do believe this is live. I'm checking on my VBF Facebook page right now to see if we are live. It looks like we are. I see a sign there. I don't see Dr. Colletti. Oh, yes, I do. I do see you, Dr. Colletti, on my
Oh,
phone.
that's nice.
So thank you, Dr. Colletti, for joining us for our February 2026 VBF Facebook Live. And thank you, Deb, always for helping us get everything set up and running
That's
properly.
a privilege for me, Linda, to be with you and to try and help everyone who connects with VBF, which is the best uh, organization in the world, in my experience, for non-for-profit in vascular anomalies. I'm telling you what I truly feel and think.
Thank you for that, Dr. Colletti. Well, we're excited. Like I told you, we're using a new service, which is called StreamYard. So everybody that's starting to log on now, let us know where you're from, okay? Let us know where you're from. And when you're asking Dr. Colletti questions, be thorough. Tell us the age of the patient, if you've had any other treatments, what you're looking for right now, so we don't have to go back and forth with multiple questions when we have a stream of patients asking questions. So ask your questions, state where you're from, how old the patient is, any treatments they've received, what the problems are. And we're also going to be talking while we're waiting. Hi, Kiana is on. Hi, Kiana.
Hi,
Kiana's saying hi, Dr. Colletti.
hi.
So let me I want to make sure I have the questions on here. Hi, Jessica Warner. She's somebody new that, Jess, because
I know her.
yes,
Yeah, I
uh,
do.
her little precious
She
little.
she she wrote some of the most heart-touching words to me. So of course
Me
I know
too.
her.
Me too. And she's very grateful for VBF and for you, with Rocky. I just love her son's name, Rocky, and that they're
Yeah,
from Philly, the home of Rocky, right, Jess?
yeah.
It's so cute. And so Jessica DeLallo is on. Hi from Yosef from Italy. Hello, Jessica. Ria Louise, hello. And all of you who are signing on. This is great. We're building everybody up. This is a new streaming service, so bear with me as I'm getting used to it too. So
Yeah.
Dr.
Rocky, by the way, he will be one of our patients undergoing the technique that you and I have published, the modified electrosclerotherapy, because he's got a venous malformation on his lip, and the his parents are very thoughtful, so they are really trying to find the best solution for him, and I'm convinced that the modified electrosclerotherapy is the way to go for venous malformations in general, but especially in the case of Rocky, because he's got a pretty small one, which will
It's
respond beautifully.
localized. But
Yes.
did you look at the imaging and see that it's not more of a pattern underneath the surface?
Yeah, I did see it. He's got just a very tiny bit of malformation in his eyelid, but that's not going to be a concern because I will be able to manage the entirety of the malformation without having to inflict the needles from outside. So, as you know, the only potential downside sometimes is that with MEST, you may have some pigmentations where you like inflict the needles, and so being able to do everything from inside is a great addition. And also, because you will be one of the authors, that we are introducing an even newer technique, which is called NEST, which stays for needle-less electrosclerotherapy, because we have introduced a new device where the electroporation is delivered with a kind of a plate, so we don't need needles, and so the risk of pigmentations and even if minimal scarring is not there anymore.
What is the purpose of the plate? Is it a conductor of the electrical current?
Yeah, the plate is a 1.5 centimeter per 1 centimeter small plate with a suction device inside that. So with the suction device, you like suck in the malformation, and then in between those two plates, the current is being passed. So you have the transmission of the electrical field that causes electroporation without having to go inside with the needles.
Oh, I get it. It's making me think of the focused ultrasound, how it comes from the outside and in, and
Yeah.
you know what I mean? You're using the vibrations from the focused ultrasound, but with this, you're using the current.
Yes.
And I'm just so thrilled about these new techniques,
I
especially
just
because you said the recovery time is so much better
much
than this.
better. Yeah, I have been invited a few weeks ago in Poland, where they had 7 patients who weren't able to receive appropriate treatment for their uh, pretty complex venous malformations of the airways involving the larynx, and up till now, there wasn't really a way of managing venous malformations in the larynx. And we went there. We did these 7 patients who are doing very well. And by the way, there was the press and TV there. So,
Ooh.
yeah,
Well, we have questions coming in, Dr. Coletti. So
yeah.
in between the collection questions, we'll talk about all your new developments. So Alexandra from Romania, Bucharest said, my son Cesar, 7, had 4 laser treatments at Dr. Coletti's and the results are amazing. Thank you, Dr. Coletti, for everything. You are the best.
Oh, you are the best.
So she
Thank
said
you.
he
Thank you.
had the
That means a
one.
lot for me.
Yeah, he had the first one at our 2024 clinic in Milan. So thank you for that shout out. Jessica Delalo would like to know if sclerotherapy is advised for Gorham Stout. Now, I actually know what Gorham Stout syndrome is. Do you?
Yeah. Yeah. So, Gorham stout is a pretty complex disease. And it seems like there are very few in the world who really understand what's happening. Gorham stout is part of a wider chapter called complex lymphatic malformations. To that chapter pertain the generalized lymphatic anomaly, the caposiform endotheliomatosis, and the Gorham stout, as well as the central conducting lymphatic anomaly. So one of the features, but the more critical one of Gorham stout is that there is an invasion of the lymphatic malformation inside the bone.
Into the bone. Yep.
Yes, and
And
that
it atrophies the bone.
it destroys it actually because it
Yeah.
substitutes the bone with lymphatic chambers.
So does
And
it replace the osteocytes, the bone cells itself?
yes,
Wow.
yes. Well, the mechanism is pretty complex, but to make a very long story short, uh, lymphatics are not supposed to be within the bone. They are supposed to be just outside and around the bone, not inside. So what happens when the lymphatic enters the bone is that the lymphatic cell produces VEGF. VEGF in turn activates osteoclasts.
Mm.
Osteoclasts will resorb the bone and in turn promote lymphatic proliferation. So it's a vicious circle that
Yeah.
amplifies the yeah, and this is why a Gorham stout disease is usually progressive. There were many techniques have been tried, methods over the years. So these phosphonates, which are drugs that limit the effectiveness of osteoclast, and other were tried, but none really proved effective enough for Gorham Stout. So yes, there is a role for electrosclerotherapy, but my first approach with Gorham Stout is removal of the lymphatic component, substitution of the bone with other bone that can be taken from it's a fresh frozen bone. And especially, this is the key to everything, you're going to want to put a layer of resorbable material soaked in bleomycin, because bleomycin will stop lymphatic cells,
Proliferation, yeah.
correct, and will favor bone production. So this is the key. I have been managing several patients with Gorham Stout with that. I had a patient who
Have
had
you published on this?
I submitted the paper.
Okay. This is very important because there are so few people who know how to properly treat this in the world.
Yeah, I remember one was a very small, young kid. He was 2 years old when I first did surgery on him, and he had his entire left mandible resorbed. And I did that surgery, and the funny thing is that the bone grew too much. you so I had to remodel it surgically eventually when he was
So
8.
that's interesting because the bone catches up from what it had lost. It's like a timer, and
Yes.
it will. So that has to be factored in when you're planning this.
Yeah. Yeah.
Well, we have a lot of questions, Dr. Colletti. This is great, and she can reach out to you. Kiana and Deb can post your email on here for them to reach out to you. Alexandra wants to know when you're getting the VBeam Pro. I don't see that anytime soon.
No, unfortunately, there are at least administrative issues with the CE approval.
Right.
So actually, I don't know when it will be available in Europe.
Yeah, I know.
And I think you don't know too.
No, we
don't
don't
know either.
No, we don't. Zoran is saying hi to us, Barkat. Hi, Zoran from Croatia. Dr. Barkat comes to our meetings. Hopefully he'll come to Bucharest. Kelly Upton, do you have any Canadian counterparts that we can connect to? Unfortunately, no. However, Kelly, I did post an announcement, and you can find it on my Facebook page. If we're not friends already, Kelly, you can find me at Linda Roselle Shannon on Facebook. I'm the only one. And you'll see an announcement of a new Vascular Anomalies Alliance that has formed in Canada. And the doctor heading it up is a well-known interventional radiologist. So he may be able to at least help you to find, depending on what the condition is, he may be able to help you to find a counterpart. I've just now found out about this and have been promoting it.
Yeah, but I'm not sure there is. Well, the fact that I am treating patients coming from Canada tells me.
I know.
I will be treating. Her name. I cannot mention her for privacy reasons, but I will be treating a small kid in 2 weeks now, and she comes from Canada actually.
I know. We know, and I met with the Dr. Philip, who is the chairman of this new Vascular Anomalies Foundation. He's a retired interventional radiologist, and he's trying to build a network there. So hopefully he'll come to New York and meet with you, and you guys can work on something.
Yeah.
Yes, Dr. Colletti does his laser treatments in Milan. And his email is giacomo.colletti@gmail.com. Kiana can post it for you below. There it is already, so you can reach out. I know you used to be doing them weekly. What are you doing them now? Monthly, the laser treatments?
Well, it depends, because I used to do it weekly because I had time to.
Right.
I don't have that much time now because I need to take care of patients with more severe
Right.
conditions, so they have the priority. However, if they write to Julia, who's my assistant, she will be able to find a spot to whomever needs my help.
Okay, thank you for that. So Kelly said she has a port wine covering 65% of her body. Okay, Kelly, thank you for that. By the way, Kelly, one of the best laser people is Barb Humphreys, and she's in Alberta, Canada, with the Remington practice that you
Yeah,
can
they are
Google.
great.
And she treats port wines, and she is superior. So you can find her on our Ask the Experts. Also, you can email me, and I can put you in direct contact. She may even be on. Sometimes she comes on these. Ahmad, hello, Dr. Linda and Dr. I hope you are doing well. My son is doing very well after the surgery, and he says, hello, Dr. Colletti from Lebanon. That is Ahmad
Hi.
Ekalad. So that's
Oh, hi. How is he doing?
He said he's doing great, and he says hello to you. So that's wonderful.
How are things in Lebanon? I remember, if I recall, we should have been doing some procedure, but he couldn't come because of the unrest that there was in Lebanon. I hope all of that is settled.
Well, nothing's settled in this world right now. It's
Yeah, I
that
know.
way. Holly is on. Can electrosclerotherapy be used on high flow AVMs or just low flow?
Well, it used to be possible to rely on electrosclerotherapy for low flow malformations only until we developed this modification of the technique. It's called modified electrosclerotherapy, MEST. You can find online the paper that I wrote because I paid for the publisher to make it available for free to everyone, for everyone. So if you go and Google MEST, modified electrosclerotherapy, you can find the paper that we have published. Actually, with this new technique, I think there is really a revolution because MEST is able to manage AVMs that were usually managed with destructive surgery, whereas now they can be managed minimally with minimally invasive techniques like this one, of
Okay.
which I'm pretty proud, and you are too.
Oh, yes. This is like the most significant improvement in the treatment of high flow lesions and low flow lesions in the history of treatment of these.
Yeah,
Because
I agree.
as you and I both know, well, we have patients that have had 60 treatments for a venous malformation because they kept coming back,
Yeah.
and more than that for AVM. So yeah, this is a big game changer. So go who's line who has written to you. He said, my name is Carlos Gonzalo. We've been
Yeah.
in contact, and you mentioned that MEST could help me significantly. I would like to ask whether it is usually performed in a single session or if multiple may be required depending on each patient's AVM.
So he has a pretty extensive arteriovenous malformation involving the orbit, but also the temporal region and the scalp. So in cases where the malformation is pretty rife, there may be the need for more than one. I wouldn't be surprised if we needed two, maybe even three. But the results are granted. I mean, I have been managing cases of periorbital arteriovenous malformations much worse than Carlos's AVM, and the results again are astonishing. I just submitted a paper. It's a follow-up to the original one because I'm presenting the results where I use MEST plus surgery, and I mean, those results are unbelievable. Unbelievable.
I just love being a part of this revolution.
You are.
Zoran posted a question. That's the derm from Croatia. He wanted to know, and you remember we were doing this project, Dr. Colletti, about preheating the skin before you do the treatment. Remember we used the hair dryer,
Absolutely. Yeah.
the Photona. By the way, Zoran, Barb Humphreys, the laser expert from Canada, she used the
Defocused and the ag.
yes, she used, no, it was the Photona, which it is like a YAG, but it's more gentle and it thermally preheated it. It's used for cosmetic procedures and then treated resistant stains and saw a great improvement.
Yeah. However, I really do believe that. So as you know, because we did that together, we did a recent systematic review of the literature, and it turns out that unfortunately, there weren't any breakthrough in the management of capillary malformations. Maybe the weekly treatment that Royce Geronimos is trying now, maybe that may make a difference. But in terms of technologies, we are waiting for the Pro because, as you may or may not know, one of the issues with capillary malformations, port wine stains, is the depth of the disease. And one of the limits of PDL is that the penetration of the beam is rather limited and dependent on the fluency, but especially on the size of the spot. And the new Pro has a wider spot that is able to penetrate deeper than the usual PDLs. So maybe that will help.
It's deeper, faster, bigger spot size, and it has pre-cooling and post-cooling. So the pain is reported as 50 to 75% less without anesthesia. So I'm thrilled. More questions coming in. Virginia wants to know, should the inside of the lip be treated with a laser? Would it make a difference with the drooping? So obviously it's like a port wine, I'm assuming. You didn't say, Virginia, you just said we made an announcement to like be pretty detailed in what you're putting in your report.
Yeah, if that's
the lesion is, we don't know what you're talking about, Virginia. Is it a venous, a port wine, right? Like we don't know.
Yeah, in general, though, if it's a port wine, that is hypertrophy and the solution is surgical. Whereas if it's a venous malformation, then again, MEST may be the fastest and more effective solution.
Okay, so Sylvia wants to know, what is your approach to a 4-year-old with a port wine stain? Could you share your experiences with treatment at this age without general anesthesia?
Yeah, that is highly variable. There are a few kids who are perfectly able to tolerate the procedure without general anesthesia. Some others are simply not able to do so. And hence, one has to adapt to the needs of the patient and the parents, because I believe the best doctor for a baby is his parent, his or her parent, and they are able to judge if the procedure is tolerable or if it's too much.
I always tell everybody I'm a twin, and playing street kickball, I dislocated my pinky and it went sideways. My twin passed out, freaked out, ran home, and I ran in the fire department and asked them to straighten my finger out so I could finish the game, and I did. And we're twins, raised in the same house.
That's insane.
So everybody responds to pain different, and parents, you must listen to your child and know them. I think we agree on that. So this is a great question. I know the answer, but I want to hear from you. Alicia says, can MEST help with Kaposi form of hemangioma endothelioma?
Absolutely.
And,
Absolutely.
and then she called it KMP, which sometimes,
Absolutely. I can tell you from experience. I did a few months ago she's 11 years old. Everything was tried on her, and she was under sirolimus, rapamycin, but she
for
couldn't
probably 2 years, right? For years, I
for
bet.
years. Yes, but she had to withdraw from the drug, and the KMP, KHE, sorry, rapidly grew back, and we did a single session of mast, and there's no more disease, no more active disease. So
That's,
yeah, absolutely, yes.
and how many treatments?
Now, in that case, it was just one, but
Wow,
that is not really predictable.
that's amazing. What is, okay, so that's that one. Let me just go to the next one. Lots of people are on. Port wine stain. Yes. So Virginia, the one that we said she didn't mention whether it was venous lymphatic. It was a port wine,
Yeah.
and she was asking about that.
So then
Um,
that is surgical.
right. So
Solution is surgical.
Stacy was saying, what are you saying? Exciting what you are saying about MEST. I've read from different posts about this being a cure. Is that correct?
It depends. It depends. If you say a cure, meaning the AVM is gone forever, that is too early for me to say because some AVMs will recur a decade after treatment. So I cannot tell. What I can tell you is that the results are so encouraging that even if you had a relapse, when that happens, you only need another mast. So maybe it's not curing. We don't know that yet, but even if it wasn't, it's repeatable. So
And we also you and I have been talking about it. So we have lymphatic malformations, arteriovenous, and venous.
yeah.
Now, the lymphatic malformations you can use the MEST for, correct? And would you say of the three, the lymphatic, the venous, and the arteriovenous, which one responds the best to the MEST?
I would say that venous malformations respond so well that I hardly see another indication for widespread venous malformations. If it's tiny, limited, then you can do simple sclerotherapy or even surgery in some cases. But if it's a diffused one, then MEST is the treatment to use.
There is a correction from Stacy. She said you said the wrong one. She said she wanted to know if MEST would be a cure for venous. That's what she meant, not AVM.
Yeah, that again, it's a very good question. So, again, a very long story short, it's unlikely that a venous malformation can be completely eradicated with whichever means you adopt, except for radical surgery, which is out of the equation because it's too damaging in terms of consequences. But what I can tell you is that the results with the MEST are so huge that even if one had a recurrence of the malformation, then it would be years after that and it would be minor.
That's wonderful. I mean, people haven't been able to say that. And like you and I have talked about these ethanol injections that destroy
Which I
tissue.
did use, and you know that.
I know. And it can be highly destructive.
Absolutely. And
Well,
it's very dangerous. Even famous world renowned doctors relying on ethanol had disastrous complications. some patients died because of that.
Well, that's why you need somebody that knows what they're doing.
Yeah.
Susie is 60 years old and wants to know, is it reasonable for her to start laser treatment at this age?
Well, I suppose we're talking Port Weinstein.
Yes.
Yes, absolutely.
Yep. Okay, thank you for that. And again, you can look at our website because we have a free laser clinic in New York City. We have a free laser clinic in Bucharest, and we may be adding another one. We have one in Miami next month. So, Susie, I don't know where you're from, but you can go to our website at birthmark.org, and right on the front, it tells you where all the free clinics are. And by the way, March 1st, which is right around the corner, we open registration for our free clinic in New York City. Dr. Colletti will be there doing the ultrasound diagnostics free clinic. So make sure you put October 9th and 10th aside if you want to come. We do free lodging, parking, ultrasound, consultation, laser, dental, glaucoma, you name it, birthmark.org. Go to our front page. You'll see when it's all there. And I did put it in here, no shame, but in order for us to continue to do these free sessions, we really need your support. So if you could make even a small donation at birthmark.org/donate, it would enable us to continue to do these free services. Kathy wants to know, what does MEST stand for?
It's modified electrosclerotherapy.
So it is, explain what it is.
So it's the concept is this one. We know that there are molecules, drugs, that can act on diseased endothelial cells, the ones which are responsible for the disease. But usually the effectiveness of those drugs, molecules, is low. So you are either going to need so many sessions, so many treatments, or sometimes you even can have an effectiveness so low that you need to switch and do like massive surgery and things like that. So what we introduced is this machine called electroporator. And with an electroporator, we deliver a source of electrical energy, a very powerful one, high voltage, but very low in duration. That electrical current opens a cell membrane, allowing the molecule to penetrate inside the cell and making it 100 times plus more effective. So basically, you are relying on a known technique, but on steroids, so to say, so to speak.
I like that. Dawn Marie says, I'm just coming on. So Dawn, we ask everybody to say who you are, where you're from, what is the malformation type you have, what is the diagnosis, because it's hard to answer because AVMs, venous malformations, and lymphatics are completely treated different. They behave different. So her question is, I'm just coming on, can this procedure, the MEST, help cure vascular malformation abnormalities or help compress it for an extended period of time? But I don't know what malformation type she's talking about because she didn't state it.
Yeah. MEST is incredibly effective. Incredibly effective means that you can expect in a venous malformation, say, in a very extensive one, a reduction in size of, say, 90%. Okay. So if you're asking me, are you going to cure the malformation forever? The answer is, I don't know. We don't know. Maybe not. Maybe yes. Maybe not. But the result is so impressive that you will not care about curing anymore. because you know that even if you have some relapse, recurrence, then an AVMs is just the only thing you're gonna need, and not complex surgeries, embolizations, thousands of sclerotherapy sessions, nothing like that anymore.
Exactly. And remember, everybody, Dr. Colletti comes to our conference in New York every year and does free consultations for those of you who have not been to one of ours, which birthmark.org is where you can go and get the schedule. Shandi jumped on late. And what's new with light therapies? Well, you can talk about that, but Dr. Colletti, the pulse dye laser is still the gold standard. There's a
Yes,
lot of talk out there about photodynamic therapy, but our doctors here do not like it. There's different light therapies that have mild effects. Again, I try to let everybody understand this visual where the capillaries weave in the skin. There's some up at the top, there's some just below, there's some in the middle, and there's some deep. The laser can only penetrate 1 millimeter, maybe 1.5. So it's getting
correct.
these vessels, and sometimes these will migrate up to the top and we can get those. But the reason you still see stain is because that laser during that treatment couldn't reach all the vessels. And that's why the pulse dye laser is the most effective, where any of the other light therapies, they just don't go to these levels. They might help here, but that's it. So if it's a tiny, small, pale, maybe. Do you have anything different you want to add, Dr. Colletti,
No,
to?
absolutely. I think you said it all. Some are talking, as you perfectly know, about this technique, which is not new actually, of the 532 KTP and the ag associated that is showing promising results. But the downside of it is that complications are much more frequent. So the risk of burning with that laser is much higher than with PDL. So one may wonder, is it worth it? Risking scarring, extensive scarring, just to try and light it a bit more than a normal PDL would do? I'm not sure.
I'm not sure either. Sophia asks, hi both. They're coming to the clinic in Romania and they're coming from the UK. And she wants to know what kind of information does the ultrasound consultation give you regarding patients with port wine stains? Like why is that important?
Well, when we did the free consultations both in the US and in Italy during the super clinic, because we held the super clinic for 4 years in Italy, um, and also in the US, there are cases where a diagnosis of port wine stain was never discussed, but the results with laser were so and so. So we did the ultrasound and we changed the diagnosis from port wine stain to capillary arteriovenous malformation. And that changes everything because that is a totally different disease. A laser is not suggested. It can be harmful sometimes. And also, but that is slightly less predictable. The amount of vessels, if there are those vessels that inhabit an area, may predict the risk of hypertrophy. But essentially, the role of ultrasound is excluding more complex and dangerous diseases,
Thank you for
mimicking
that.
port wine stains.
Beth has a question that I can answer, and it's about the PDT, photodynamic, that's used in China. Now, I know you have a little bit different opinion from me on it because I know some of your friends are using it and saying they're getting good results. But I will tell you that Dr. Geronimus, Dr. Nelson, Dr. Goldberg, Dr. Rox Sanderson,
I am aware.
and Dr. Henry Chan from Shanghai all past presidents of the Laser Society do not like it. They do not like the outcomes, the long term. They feel it is not effective, but we will have to wait because this new therapy is evolving. I personally do not like the prep for it, but maybe over the years that will improve and it will become an option. But at this point, we
You,
do not recommend it.
no, I don't feel like I recommend it either. The thing is, I was in Shanghai and observed the results with PDT, and the results were encouraging. I can tell you firsthand. However, again, PDT has significant downsides. The first one is that you will need to inject IV a molecule which reacts to every kind of light. So for 2 weeks at least after the procedure, you cannot go out. You cannot even receive indirect sun exposure because that will burn your skin. And this is the first one. The second one is that it is very exceptionally difficult to decide when the light you are administering after you gave the drug is enough or is too much. When it's too much, you have burns, like burns. So I think it takes someone with enormous experience to be able to make things in the right way. And even then, I think it's way more dangerous than PDL.
And we have to understand, in one hospital in China alone, they see 40 to 50,000 vascular birthmarks a year. So on the numbers alone, if they're treating thousands with the PDT and they get a half a dozen, 2 dozen great outcomes, they're going to consider it a success. And that's
Yeah.
just based on volume. So we're collecting data on it. This is a great question for you, Dr. Colletti. Her name is Anna, and she is interested in the quality of life for people with face syndrome and risks of doing reconstruction caused by the hemangioma because she is missing a carotid artery.
That's a fantastic question.
I know.
Um, yeah. In general, the vascularity of the face is so complex, so intricate that random flaps are doable, especially if you have to reconstruct huge areas. You want to start with an expansion procedure. So you're going to put a kind of a balloon underneath the skin and inflate that balloon progressively so that new skin is built. And when the skin is enough, you can remove the balloon and do the reconstruction. However, I must tell you that I don't have personal experience in doing reconstructions in patients lacking a carotid. I mean, if you say that he's lacking the carotid, I suppose he's lacking both the internal and external carotid, which I never did. If it's just in,
She said missing one carotid artery.
yeah, but I mean, we have four carotids. We have two internal and two external. So if she only misses, which is what usually happens with face, the internal carotid artery, then reconstruction is not an issue at all. If the entire carotid, both internal and external, is missing, then reconstruction may be more at risk. And even then, it depends on what we're talking about when we're talking reconstruction, because free flaps, microvascular free flaps, can be done even in the absence of a carotid artery.
Okay, thank you for that. We have a lot of questions. Joe is from Vancouver, British Columbia. His daughter is 18 with a large facial port wine, including one side of her upper lip and gums. She's had 20 laser treatments and needs debulking. they're looking for a surgeon. We
Yeah.
don't, I mean, they can check with our contact in Canada,
Yeah.
Barb Humphreys, but I
Sure.
don't know right now who these reconstruction experts are in Canada.
I don't know either, but I think that asking Barbara is a very good hint.
Yeah. Yeah, you can email me, or Kiana or someone that's on can provide you with Barbara Humphrey's email. She runs the clinic with Dr. Remington in Alberta, Canada, and they are connected to this new Vascular Anomalies Alliance that has interventional radiologists and some other surgeons. I just found out about the group. I posted it on Facebook. So go to my Facebook page, Linda Roselle Shannon on Facebook. You can see that Canadian post with the email and all of that regarding their new foundation. Stacy says, this is amazing. How many years have you been doing MEST, and how are you able to tell the effectiveness for years to come?
Well, this is the fifth year that we have been doing MEST. You will need to reassess the area at least with ultrasound every 3 months. I prefer doing it 2 months after the first year, in the first year post treatment, and then with MRIs at least yearly. This is how we check, we say follow up our patients. But again, 5 years is now a good time frame to tell it works very, very much.
And you'll know it's either going to work or not. And when it works, it works. It's not going backwards, correct?
Correct.
When it works, it works. Great question from Jessica, Rocky's mom, my little precious Rocky, little twin. She wants to know which one would be better for him, MEST or NEST, given the venous malformation.
So NEST can penetrate just a little more than 1 centimeter. So I would need to see him to understand if the malformation is superficial enough for me to just use the needleless, or if I need to use the conventional needle based. But in any case, I told you, if we need to use the needle based electrode, it's not an issue because I will do everything from the inside of the mouth. So no marks are going to be left.
Thank you. Margot Elizabeth says, just to confirm, you said the registration opens March 1st. Yes, my daughter has venous lymphatic. She has a lymphovenous malformation that extends from base of her tongue to her epiglottis.
That's exactly the perfect indication for NEST.
I was just going to say that's
sorry.
Eddie's perfect example for what he wants to use the NEST procedure for.
Exactly.
So don't forget to come, Margot. And you don't have to wait. You can email Dr. Colletti at giacomo.colletti@gmail.com and do a virtual consult with him through his medical team in Italy if you want, or you can wait till October. Also, there is consideration. We will both be at the ISFA, which is the International Society for the Study of Vascular Anomalies, meeting in May together in Philadelphia. So we may be offering a little free informal ultrasound on the side. If you would seriously be interested in that, you need to email me at vbfpresident@gmail.com. I won't be posting this, but I will be talking about it to kind of keep it kind of low key. So if that's an option for you, then you can email me at vbfpresident@gmail.com. Kiara says, my son is 4 years old, has CMTC. Is there any knowledge or advice you can share on CMTC?
Unfortunately, I have no good news for you. CMTC remains a very difficult to treat birthmark. And so, no, you can try again. You can try PDL. It has some results, but not outstanding ones. Unfortunately, it's very resistant.
Amanda says her daughter is 10. She has a birthmark on her lower cheek and part of her lip that goes into her mouth and partway into her ear. We're going to assume, again, Amanda, we've asked all of you to tell us the birthmark type. Thank you for telling the age and any treatments. So I guess we're assuming, is this a port wine or is this venous? She's not had any laser treatments. Okay, so we're going to assume that it's a port wine stain. And there's been no changes. Should we be looking for laser or waiting for new treatment to come out? Because I'm assuming she's 10 and she has a port wine on her cheek, her lip.
She needs treatment with laser right away.
Okay. But that we're assuming it's port wine, but it wasn't spelled out.
Even if it was a venous.
Okay. Thank you for your lots of people. My son, Rosie Gutierrez, her son is 2.5. He has had 3 sclerotherapies so far. We're looking to see you guys in New York. Could you discuss how much treatment would be a baseline? We are from Canada. But I guess that she'll have to talk to you about that when she sees you in person at the clinic. Because it all depends on if they have to stay over or if it can be done without an overnight stay. That changes it so much.
Yes.
So it could be from 15 to 30 grand. But again, also Dr. Colletti writes letters for insurance, but you're coming from another complete different system. I don't know if it works with Canada, but sometimes with the US it does work for trying to get some reimbursement. Zeraldi again says, my 5.5-year-old son has port wine on his palate, and it also affected on the side of his face, a little lower than the other side, and his teeth also are bigger. Yep, it's probably got the canting. It sounds.
Yes, I suppose it's more the maxilla and not the palate, the upper jaw.
Well, the palate has stain on it, she said.
Yeah. I mean, that's full thickness.
Right.
But what grows is the maxilla.
Right.
That's pretty typical. And the overgrowth is usually in the vertical dimension.
Right.
So you have a canting of the occlusal plane, like the teeth are a little lower on one side. And before that happens, it's pretty typical that teeth will erupt earlier on the affected side, and they may be bigger than the contralateral.
And I always tell everybody, go ahead.
If the asymmetry is obvious, then usually there is the need for orthodontic surgery, meaning bony surgery on the bone.
And I know you do that because I've seen.
Of course.
You've done it for. I always tell patients this and the parents, and no doctors told them this, I don't know why. Tip your head back and you can see the nostril skew over, and that means this is the bone that has the overgrowth on it. And
exactly.
This is shifting. It shifts the gums, which causes them to be crooked. And it just can really, and I know a lot of people that have this think braces are going to correct it. It's marginal. And I mean, I guess it's not bad to have the braces on, but don't have the expectation that braces are going to correct an overgrown bone. The only way the overgrown bone is corrected is with surgery. That's it. No other choice.
Yeah. Correct? Unfortunately, you're right.
Yeah. Another one from Canada. So this is Patricia. I have a venous malformation by the facial nerve within the masseter. Ooh, tough location, but that's okay. I've received.
Not really.
I've received mixed information on the risks of nerves damage with sclerotherapy. Do your electrosclerotherapy options have a different risk compared to typical?
Zero risk on the facial nerve.
Beautiful.
Zero.
There you go. There you go, Patricia. So you should come to our super clinic in October. Remember, everybody, registration opens Monday, March 1st. We do provide free hotel for one night, free ultrasound, free consultation with Dr. Colletti, free ultrasound with him, glaucoma check, dental exam with Dr. Darrow for anyone with dental involvement, psychotherapy with Leslie, Sturge-Weber assessment. I mean, nobody does what we do in the whole wide world with these super
Absolutely.
clinics that we have, one a year in Europe. This year it's in Bucharest. You can find that on our website. So any of you who are in Europe that want to see Dr. Colletti, he will be with me in June in Bucharest doing ultrasound, and he will be with me in October in New York and in May in Philadelphia. So watch our website at birthmark.org for the clinics. I'm going through, lots of people on, lots of people thanking us. Deanna is from the UK. She's 68, has a port wine on the right side. She's had laser surgery over 30 years ago. They were terrible back then. And it wasn't successful. And that they were painful, copper vapor. You remember those old,
Yeah.
they're just nasty. What are my options now in the UK? There is a group on Facebook called the Birthmarks Support Group. And it's a pink and purple logo. They now have a new list of all the doctors that treat. I just posted about it. Look at my Facebook page, Linda Roselle Shannon, and you'll see down below where I posted a link which tells who all those doctors are. And there are more and more now because we're pushing the UK to get more. People are leaving the UK to come to other parts of Europe and the US for treatment. So now more people in the UK are offering it. And we're glad that we're pushing the meter on that. We're very glad. So you can look on my Facebook page. If not, find them. It's called the Birthmark Support Group on Facebook. And then Anna says, I would appreciate it if you would share your experience with quality of life with children with face syndromes in adulthood. I will tell you this. I myself, because I've been doing this for 32 years, have seen babies that grew up to be adults with face syndrome that never had problems, but then they had them as they got older. And endocrine problems. We had a patient that had massive face syndrome where it affected her hypothalamus, so she had endocrine problems. Some people can have cardiac problems. Some people can have posterior fossa related issues.
Yeah.
So, I mean, I don't know if you want to add anything, but I have not seen a qualitative quality of
No,
life
me neither.
on this, which would be a great thing to do. And it's important, and it could be something we could put on our calendar to try to do a quality of life study with the various face groups and see if we can get some good information. Stacy wants to know if Nest is effective as MEST for a facial venous malformation.
They both have their indications. Okay. When the main issue is in the mucosa, so say lip, inner part of the lip, cheek, tongue, palate, pharynx, then the indication there is to use Nest. If it's full thickness and very big, like in the cheek or masseter muscle or temporalis area, then MEST is the one that it's indicated.
Thank you. We got to hurry up. We only got a few minutes left. This has been like whirlwind. It's every time I'm on with you, the question.
Yeah, it was so fast.
It goes so fast. So Shannon Verheist, what's next? Because you are with the Remington Group getting the best laser treatment you will get, the best. The only thing coming is the Pro. So when they get the Pro, you'll get a better treatment. We will have the Pro at the Super Clinic in New York. So anyone who comes to New York will be getting treatments with the new Pro. Ali Pedrick, Dr. Colletti, Will either of you, yes, we'll be at ISFA. My son's case will be presented by the MUSC group in the panel section. Great. I look forward to seeing that.
We have 3 talks at ISPA this year.
Yes.
One is about nest, one is about mest.
Awesome. And Beth, I think that might be our last. We have a daughter with a facial port wine on the right side through eye and mouth, age 1. Teeth came in, which we know quicker. What age should we see a dentist, orthodontist? You should come to our conference in October in New York City, because the only true dentist trained in gums with port wine and all of that is Dr. Darrow. And he comes and does a free full dental clinic. So that's in October, Beth, at our website. Registration opens on March 1st. He is really the only dentist that we know of in the country that does the thorough dental exams. Gohu says, if multiple MES sessions are required, how often are they usually performed? And is there a risk that the AVM could grow back after treatment?
It's I arbitrarily decided that it's at least 3 months apart from each other, and it's better more than less than that. And can it regrow? Yeah, we said before, it's too early to say definitively, but even if it did, you will only need another mest and no big surgery, or you're never going to be bleeding or suffering because of the AVM. So
yeah, I'd like to get these final questions in, so we might go over a minute, but I just want to go through them quick. Whitney says, my 2-year-old son has a large upper venous malformation on his lip. We had electrosclerotherapy in Zurich, but it's not financially realistic to keep traveling. Is traditional sclero going to do anything at all for us?
probably.
Okay. All righty. And 53, have Sturge-Weber, but know nothing about it. And you can go on our website. We have a section right on the front. You'll see a picture of Sturge-Weber, and we have a fact book. Near says my son's 11 years old. On the left lower cheek, LVM. On the facial nerve, all of the cases in which you have performed, what percent are after surgery to remove it? The malformation never came back in the range of 12 to 15 plus years. What is the reason they tend to come back? How is it different from a blood vessel tumor, like a hemangioma?
It's totally different, because a tumor has a clonal cell line that proliferates, meaning it all starts from a single cell that for various reasons starts to replicate itself, and it creates a mass there. Whereas a malformation is an area where there are diseased vessels, not a single one, diseased vessels that produce abnormal vessels, but it's not a tumor because there is no proliferation in the strict sense. Some malformations can be pretty aggressive. That is absolutely true. There can be some proliferation in venous malformations after there is a episode of localized intravascular coagulation or trauma, because that is a reparation phenomenon where cells replicate to reconstruct the vessel. But other than that, there is no proliferation in vascular malformations, whereas there is proliferation in tumors.
Okay, thank you. Well, everybody, for those of you with more questions who said they came in late, like Rosie, this will be on our page on Facebook for 30 days. Then when you go to our website at birthmark.org and click on our YouTube icon, you can watch every Facebook Live I've done with Dr. Colletti throughout the years, and any other doctor. They're always there. We keep them all. Thank you, Dr. Colletti. It was phenomenal.
It was a pleasure.
I look forward to seeing you soon. We've got a lot of work we're going to be doing together this year. And hopefully when we come back from ISFA, we'll have a lot of good information to share with our families on new treatment modalities, or at least some new research to get us some better clarification on how these behave and how we can improve the quality of life for these families. So thank you very much.
Yeah.
Stay safe, and we're in blizzard season. So, and I know you just came off of the Olympics, so I guess we're both,
We did.
coming
That
off.
was our blizzard.
Yes, that was your blizzard. So thank you very much, Dr. Colletti.
Thank you, Dr. Linda. See you soon.